Most of us believe that when we have a cancer diagnosis, the only options are radiation or chemotherapy. Some of us know that there is also an option of metabolic therapy, such as a ketogenic diet and using a glutamine blocking medication. The problem is that the glutamine medication is still in research purposes. So, what do we do if we actually have cancer? If we know that standard care doesn't always cut it, do we go through chemotherapy and radiation? In this conversation, we talk about other cancer treatment modalities and things that we can do for prevention. We listened to the dietary guidelines. All it did was make me sick. I now eat a lot of meat, and so do they. If you want to thrive, you need to eat meat. Meat is required. Meat is non-negotiable. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private functional medicine practice where we focus on root cause healing, and that often starts with the Carnivore Cure's all meat elimination diet. Today I have the pleasure of sitting down with Dr. Michael Karlfeldt. He is the founder of the Karlfeldt Center. They do integrative medicine, cancer treatment, cancer therapies, integrative medicine, and also he is the author of A Better Way to Treat Cancer. I will put all of this information in the show notes. In this book and in our conversation, we talk about how to discuss cancer in an integrative way. What are levers we can pull? Do we need chemotherapy and radiation? Are there instances that we should use it? What are other tools we can use? How important is a ketogenic diet? How important is fasting? Do we fast while we are going through therapy? What are other levers we can use? And he shares the top 3 things or tools or levers we can use when we are diagnosed with cancer. I personally think that if you can use this during cancer, these 3 tools should also be used as a prophylactic of cancer. No one wants to get diagnosed with cancer and no one wants to hear the bad news, but we should never hear the diagnosis and then lead in fear. Fear is something that we lose all power. And so if we can walk in knowledge and then make decisions outside of fear, then maybe we have a better outcome if we actually get diagnosed with cancer or if we have loved ones that do. The key, though, is that we are preventative. We do the right things in our lives today before cancer can proliferate. We all have cancer cells in us. The key is that we don't turn them on. And I hope that this conversation, or if you get this book, it teaches some of the ways that you never have to get a cancer diagnosis. Let's get right into the interview. Hi, Dr. Karlfeldt. I'm very excited to have you on my channel. As I was telling you offline, I saw you at one of the conferences where you talked a lot about cancer therapy and other modalities of care other than the standard care treatment. And I'd love to dive into that with you today. For the people that may not have heard of you, if you can introduce yourself to the people that are watching and listening.
Absolutely. My name is Dr. Michael Karlfeldt. I'm a naturopathic doctor. I've been in clinical practice since 1987, so for a bit. Hundreds of thousands of patient interactions, and patients come to me, for a little bit of everything. But one of my specialties is integrative oncology. I did write a book, A Better Way to Treat Cancer, that ended up on Amazon's #1 in those categories. I have a cancer podcast called the Integrative Cancer Solution with Dr. Karlfeldt. I also have one online, and then also another one that's called the Dr. K Show, which is a little bit more a broader discussion where it's not just focused on cancer or Lyme, where we talk about all different things. Couple of TV shows, radio show. So I love education. I love this format with podcasts, and that's why I love being on people's podcasts and having them on mine, so we can share and bring out this important information to everybody. I own a larger center here in Boise, Idaho, called the Karlfeldt Center. It's a facility of about 17,000 square feet where we try to bring all the different modalities, that we can under one roof. So when people come here, that they can then be taken care of, and many in many areas. And whether you're dealing then with cancer, or you want to do it for regenerative purposes, or dealing with Lyme or chronic illness or whatever it may be, then we have lots of modalities here. We put together a protocol for you to address those things. We do offer telemedicine. We do a lot. So yeah, I'm here to support people whichever way that they need help.
Yeah, I love it. I love that in your talk, even if it was specific for cancer, I could tell you were super holistic with diet, with fasting. And so we'll get into some of that. And I'll probably have to have you on another time to talk about your Lyme treatments because that is also a area that are the people that are listening and watching also suffer from. But in standard cancer treatment, we use radiation and chemotherapy, and it sounds like there are other options. I'd love to hear from you why we use those things and why it may not always be the best modalities, and then what you think is a better approach for cancer.
Yeah, I mean, the chemo essentially started with mustard gas. We're seeing people that were receiving these toxic chemicals that yes, it was toxic to them, but somehow their cancer shrunk. Now they started to look at, what other toxic agents could we use to shrink tumors, and how can we implement these while, also keeping the person alive. So what kind of dosage should we use? What kind of so that is essentially what chemo is. Find that perfect spot where we shrink the tumor, but don't kill the person. Obviously, that they were not very successful at that in the past. They've gotten a little bit better at it, but the statistics are still not very good for using chemo for longevity, for to keep cancer away. It's awesome at shrinking tumors, but not so good for cancer. Radiation is also another thing. Yeah, we can use radiation to essentially just burn the tumor, and that is kind of the next step that they're doing. And they're using radiation because surgery that can be a little bit more intrusive, and you may not be able to kind of target very small areas or so then they do radiation for that. The challenge is that these therapies, we haven't really evolved that much in traditional oncology. The studies show that people live, if they did nothing compared to using traditional oncology, their 5-year survival rate is a little bit above 2 to 3% more than if they did nothing. And then also the life expansion, the increase of life expansion is also around between 2 to 3 months, which is kind of interesting. Yeah, so 2 to 3% better, survival rate 5 year, and then 2 to 3 months living longer with traditional oncology. So it poses a lot of challenges, and one of the challenges, obviously, it is destructive. Yeah, it is not good for the immune system. And there's no chemo, there's no surgery, and there's no radiation that's going to get rid of all cancer. So once we've done with traditional oncology care, we ring the bell and we say, yay, we're no evidence of disease. Then after that, we need the immune system to mop up the rest. And so here we've essentially destroyed the immune system with these type of therapies. And then we expect the immune system to step in after to clean up the rest. And so that leaves people after doing these therapies very vulnerable, because now it's kind of like getting rid of all the police force, on the street. Yes, we got rid of a lot of the hoodlums, on the street, but there's still a lot left. And maybe we don't see them in these huge congregations that we would then consider like a tumor, but they are still there and they may be spread out and we're not able to recognize them as much, and we don't have any police on the streets. So they essentially now can just reorganize, and they have less resistance, and they can kind of move forward with much force. And that's kind of where we end up when we do the traditional oncology care. And there are a lot of other issues with it. I mean, one issue is that we have something called cancer stem cells. And the cancer stem cells are essentially, if we know our own stem cells, let's say you injure a kidney, injure liver, injure bone, or any kind of tissue, we have these stem cells that are kind of laying dormant and then waiting for, if a tissue is injured, to then migrate to that location and then start to heal that area and to grow that tissue. And we have the same with cancer stem cells, is that when we then injure, so to say, the cancer tissue, with radiation, with chemo, with surgery, then we have these cancer stem cells that are not impacted or destroyed by chemo radiation, because chemo radiation only impacts fast growing cells. And the cancer stem cells are slow growing cells. They're dormant. They're just kind of hanging out. So there's no chemo that's going to impact that. But essentially, what it does is that it actually, after the chemo is done, it actually activates them more. They become more aggressive because they are trying then to heal the tissue that's been damaged. They're trying to heal the tumor, the cancer that has been damaged. So they turn on and become very aggressive and very active. And that's why we have issues with reoccurrences. And a lot of times also, there may be a different type of cancer because what we've done is that we have killed off the kind of sort of subpopulation of the cancer cells that are impacted by that specific chemo. But all the other ones that are not impacted by it, they're just kind of hanging out there. And now we are selecting those to become more of the dominant type of cancer cells. And so that is another issue that is not addressed with chemo and radiation and surgery. And with surgery, it is immunosuppressive, meaning that it depletes your immune system when you do the surgery. So it is really, and people don't understand that, how important it is to boost your immune system while doing surgery. So that, when the cancer cells, because actually metastases you're at a higher risk of metastases after surgery than before, and because of that immunosuppression that's taking place, and because of the activation also of the cancer stem cells. So there are a lot of issues along with the chemo, radiation, and surgery. Doesn't mean that those tools are not needed at times, but my preference is that if we can then marry the two systems together and see what strengths do the traditional oncology have and what strengths does more of the natural therapies, the integrative tools that we offer, and then kind of bring them together at an appropriate measure. And each individual is unique, so we can't just say that every person should do this or do that. Each person is unique, and so that's why we need to kind of navigate this, with the individual and help them through that.
It sounds like with the standard cares, the radiation and chemo, though, you're sort of it's harder because one, it's affecting your immune system. So, like you said, there's no police on the street. So, if we know that there will still be some level of cancer cells, they're not maybe all together in one tumor, but they're there, and now we have no police. And then, secondly, if your stem cells, the cancer stem cells, are now activated once you stop everything, trying to fix the tumor, that area that we had attacked, now they will be much more aggressive. And if your immune system is down, and if you're also in the population that have been chronically ill with poor immune function, the risk seems so much greater. So then I'm curious, what do you use in terms of the more integrative stuff and approach?
So I have then a conversation with the patient, and obviously each patient is feel comfortable. There's certain levels of comfort in that they have, and we need to meet the patient. What feels right to them, and obviously it's a discussion that we have. And some patients feel very comfortable with doing no traditional oncology, and some people want to do a lot of traditional oncology with a little bit of support from me. So depending on where they're at, then we meet them and we develop a plan. From my point of view, cancer is essentially a way for the body to try to collect, toxic debris, toxic substances. I call it almost like the garbage dump, where we have a tumor. And so the key is then to kind of see what is in that, what's all that garbage about? Why is it there? Are we dealing with heavy metals, chemicals? Are we dealing with mold or Lyme or viruses? What is all this stuff that has been, that the body has put a lot of effort, to put together in one location, which we call the tumor. And so we know that, yes, we can then blast that tumor. But imagine this, if we radiate it and then all of that debris, that the body's put forth all that effort to put together in one location, now we're just blasting it all over the place. And so, yes, the tumor, looks like it's gone, but it's kind of like having we kind of rake all the leaves together in one location, and now we take one of those blowers and just blow it all away. So now it doesn't look like we have a tumor. We don't look like we have a leaf pile anymore, but the leaves are still there, and now they're all over the place. So now we negate all the effort that the body has put forth to put it all together in one location. So what we're wanting to do is that we're wanting them to, one, as I mentioned, identify what are we dealing with, and then support the body to be able to help to clear that out of the system so we can start to kind of eliminate, we open up kind of the drainage pathways to kind of clear that junk out. If we're dealing with parasites, and to bring in the appropriate antiparasiticals or antifungals if it's fungus. And frequently it's a combination of a little bit of all of these things. But at the same time, we need to make sure that the body's able to clear these toxins or clear the die-off material of these parasites out. So we need to open up then your eliminatory pathways, your exit pathways, like your colon, like your kidneys, your lungs, your skin, and also the processing aspect, which is your liver, and then also you have the transport, which are lymphatic. So we need to address all these things. So as we are wanting to suck out the toxic material out of the tumor, we need to make sure the rest of the body is able to handle that. And so it's not always about the tumor. It's not about, that we want to shrink that tumor. It is about making sure that the body is healthy enough to address what's in that tumor, and that becomes the key. And there's so many different tools that we can use to support the vitality of the body and clear these things out. And there are tools that we use, when we feel the body's ready, where we can also selectively go after the tumor using natural oxidative therapies, to kill off these cancer cells. Traditionally, things like high dose vitamin C that's been around for a long time that triggers production of hydrogen peroxide, within the cancer cells. So that is something that we can do. We can bring in like vitamin B17 that dumps cyanide into cancer cells to kill that off. We have artesunate that triggers ferroptosis. I do something that's very unique called photodynamic therapy, where we use a strong photosensitizer that accumulates in tumor tissue, and then we will use a laser external and intravenously, or into or around the tumor, depending on the location, to then trigger oxidation to kind of kill that tumor. While obviously, like I mentioned, supporting the rest of the body to be able to clear off all that debris. The challenge with chemo, which people don't understand, is that when you do chemo, you are lucky if you get 5% of that chemo into the actual cancer. I mean, that is a phenomenal number. So that means 95% of all those chemicals and toxins go to your healthy cells, and your healthy cells have to deal with that. And obviously, your tissue integrity, your health, your well-being is going to be so beaten down, by these chemicals. So how much better is it if we can then use therapies that are oxidative, like chemo radiation, they're oxidative therapies to oxidize the cancer cells, but are not destructive to the healthy cells, but actually supportive. Like vitamin C IV, like I mentioned, it will then oxidize the cancer cells, but healthy cells, it will then support their vitality and integrity, and also support the immune system function, also help to clear out the infection. So it has this supportive effect for the rest of the body, while then impacting negatively then the cancer itself. And B17, which I mentioned, dumps cyanide into cancer cells. And the way that it does that, it's quite phenomenal, because cancer cells are very high in a specific enzyme, So vitamin B17 is kind of like you have that cyanide as a core, and it's inside like a cage that is almost unbreakable, except for the enzyme that is in high concentration in cancer cells. So this, which is beautiful, acid then enters into the cancer cell, have those enzymes in there, they open it up, and then cyanide gets released. So it's like a Trojan horse. But then for healthy cells, there's another enzyme that will work then on the B17, and it will actually then trigger a very analgesic effect, so a very pain-killing effect. So it helps to relieve pain for healthy tissue, and then it will help to kill off cancer cells. So that's a beauty when you bring in natural therapies, is that it has all these beneficial effect on healthy tissue, and then on cancer tissue, it functions differently.
A couple questions. So the first, you mentioned that cancers or tumors can collect basically things that your body essentially cannot detox, if I'm putting it really simply. So you said mold, Lyme, heavy metals. So are you saying that the body will basically create a lump or a tumor because it's not able to detox those toxins well? And the reason I'm asking this is because most people think that cancer is just metabolic, or you're insulin resistant, your blood sugar is imbalanced and now your body's just dysregulated, or that it's genetic, that mom had breast cancer so I just have the BRCA gene, so therefore I have a higher chance of getting cancer. You're saying that it could also be a buildup of toxins, and because the body, the immune system, is not able to release it through our detox pathways, our drainage pathways, the body's doing the best it can do. Did I hear that correctly?
Yeah, absolutely. And it doesn't mean that genes do not play a role, doesn't mean that the metabolic aspects does not play a role. They do play a role, and they become impacted by the environment that exists within that tissue, within that cell. So as we then, so you kind of think of a car and its engine, which it would be kind of our mitochondria or energy factor within the cell. If we pour a bunch of dirt into our gasoline, that the metabolism of that car, or the energy of that car, is going to be heavily impacted. And it happens the same within our healthy cells. If there's a lot of toxic debris that start to then interfere with our mitochondria or our metabolism, then the mitochondria, how it functions, is going to have to shift. So it then shifts to it's kind of like a survival mechanism in a way, where it can survive under harsher environments. So it moves back to a more of a prehistoric type of function, where the mitochondria didn't play as big of a role, because the mitochondria essentially is a bacteria that infected our cells. So there was metabolic activity that existed in the cells prior to the mitochondria. So as these cells are under these harsh environments, they start to shift towards that more primal way of producing energy, which is more of a fermentation process. Um, and it is designed to just exist, be able to function in a very toxic environment. And so what happens is that the mitochondria essentially controls a lot of the genetic behavior and genetic signaling. So we have something called epigenetic, and that has to do with which genes are turned on and turned off, which ones are upregulated, downregulated. So when the mitochondria is under enough stress and it feels like I cannot survive under these circumstances if I continue the way that I do, it will then start to signal then to your genome, to your genetics, to shift. And it's like all of these different flips, or switches will flip, appropriately to, create this kind of cancer cell. And it is the mitochondria that does that. And they tried with this huge genome experiment to figure out, which one is it for pancreatic cancer, which one is it for breast cancer, and they recognize that it is different. It's like a symphony of changes, of epigenetic changes that takes place in the genome. And it's different for different individuals. So you can't just target one gene. Each person has a little kind of a different, setup. And it can be different from the same, two different people. Both of them have breast cancer, both of them are triple negative. And, but the genetic changes, epigenetic changes are different from each individual. So it is more than, the mitochondria that controls that. And it is the environment, that the mitochondria exist within that then impacts how the mitochondria behaves and how it signals then to the genome. So yes, it is really important to impact the metabolic aspect, but it is also very important to change the environment, to change the terrain in which the cells exist within and what's within the cell.
In your practice, and I know it'll be different per individual, but if somebody had a tumor and let's say it was filled with their positive for mold illness and Lyme, but do you then go after the supports of like the B17 and then try to, I guess, support that whole tumor, or do you try to go after the mold illness? Because for usually a person that's chronically ill to do all of it at once is pretty hard. Hey guys, just a really quick break. Nutrition with Judy's private practice is now called Empower Functional Health. I started as a nutritional therapist, but we have become much more all encompassing. At Empower Functional Health, we do functional medicine, chronic illness, autoimmune, gut health, environmental illness such as SIRS, mold illness, Lyme. Regardless of all these names, the goal for us is always to get you root cause healing answers. And of course, carnivore, the all meat elimination diet is always on the table. Food, the right food, is always medicine. We offer functional tests, prescription meds, and really everything to get you closer to root cause, where you can just eat the meats you enjoy and live the life that you are meant to symptom-free. The goal is to get off meds, supplements, and everything else that your body no longer needs support in. Our practice, whether it's Nutrition with Judy, sharing podcasts and free content, or our private practice, Empower Functional Health, our goal is to support you guys in the barbell theory. We give a lot of free content, our evidence-based research. We don't use Substack. We give all our stuff away for free. We interview with the best and make it super tactical so you have clinical pearls that you can walk away with and try in your own healing journey. And then we work with some people in a smaller subset, one-on-one, to provide that level of personalized care. And as we heal these people that are chronically ill, we find these clinical pearls and golden nuggets that we can share then more publicly so that we can make wellness for all. Hopefully, the content and the guides and the free stuff we give out is enough for you to heal. But if it's not, you can always come and work with us in our private practice so that you can get more personalized care. If you want to learn more, make sure to check out empowerfunctionalhealth.com.
Yeah, so you need to be strategic about it, and it also depends kind of where the individual is on their journey. So let's say you have a person where you need to kind of shrink a tumor very quickly, then you may lean more onto going after the tumor. But then when you have then the time and the ability, then what you want to do is that you want to identify and see what are some of the root causes, and there are labs you can do for that. I also use a technique called autonomic response testing that gives me a lot of information. So then you can then start working on clearing the mold, clearing if they're dealing with spirochetes or viruses or whatever it may be, to start working on that, and also making sure the individual is able then to move whatever debris it is that we're killing or detoxifying out of the system, and also that they have the nutritional fortitude and ability to be able to withstand, that we are trying to move these metals and chemicals and so forth. So it is each individual's a little bit of a dance as you're doing. And then when you feel that they are ready and able, then you can then bring in also some of these that are a little more destructive for cancer cell, like the B17 or high dose vitamin C, artesunate, or photodynamic, or things like that.
Of the Lyme, the mold, is there one that you see more prevalent? Is it sort of a mix of all of them, the heavy metals too? the
It, it
parasites?
it is a mix of all of them. I mean, everyone that exists on Earth, have too much chemicals and heavy metals. I mean, like you probably heard that, all of us we eat about a plastic, credit
Credit
card
card.
a day, and so obviously the plastic is going to dysregulate our hormonal system. It's going to, trigger inflammation. It's going to impact, our mitochondrial activity and impact our ability to toxify. And so it impacts us in so many different ways. And then heavy metals, I mean, if you, again, if you live in the world, you're going to be exposed to it. But then there are certain things that will then increase your level of heavy metals, like the silver fillings, or if people receive a lot of vaccines, the aluminum and mercury in that. Or if you live in a big city, all the exhaust that exists, aluminum deodorants, and if you what type of cookware that you use, so there are all these different things that can add to the load. Mold is something that is I would say is becoming more and more aggressive. Mold's been around for a long time.
Right.
But it really I think with all the new EMF and 5G, and it really is aggravating a lot of these different mold and spirochetes and viruses. So they are then living in a world that they are not used to, and they are then becoming more aggressive and impacting us in a more virulent way, because they are exposed to things that they don't want to, live in. There was an experiment that was done in regard to mold. We had, mold living kind of in a Faraday cage, where they were not impacted by EMF or 5G, and kind of seeing the level of replication there versus mold that was just kind of a normal environment with, the 5G and EMF and all of that. And the mold that were in the normal environment replicated about 100 times more. So if you think that, if you replicate it 100 times more, so each time the replication is 100 times more, so then we got one, then we got 100, and then we got 10,000, and then we have, so it really goes fast, how they grow, versus one to two to three, they become very aggressive, and that then, as they are aggressive, then they spew out chemicals in defense. And, obviously we inside our body becomes a war zone with all these chemicals that they secrete in defense, when they're exposed to all these unnatural, electrosmog. And then that impacts our liver, our kidneys, all our detox. And then also our immune system becomes very confused and hyperactive and inefficient. So then we're dealing with, overactive immune system in some areas, but because it's hyper focused in some areas, it's not able to focus on cancer cells and things like that. So I think all of that is just part of what we're exposed to with the type of environment that we are living in now. So we just need to be more hyper vigilant and kind of controlling what we're exposed to, and then also making sure we do a lot of preventative in order to minimize the risk of, it going to the point of cancer.
Right. And I think that's why one thing that I love about focusing on nutrition is you can give the raw materials to the body, allow it to assimilate in the areas it needs to, and then also then by focusing on real foods, you lessen the load on the immune system that's in your digestive function that has to focus on, is this a friend of a food or is this a foe of a food? And then causing, whether it's gluten, whether it's certain anti-nutrients or plant toxins that can cause toxins to build up. And then your immune system is so busy with that, it doesn't see the other stuff. Before we move on to the diet side, I wanted to ask you, in your family, just, not being a doctor, but if someone in your family had cancer, would you ever consider radiation or chemo?
Patients ask me that all the time. And so what would you do if you're in my shoes? And so I always tell them that, I know what I feel and believe right now, but it's amazing. And I've seen a lot of patients, in this situation before. They're, stunned. I'm not going to do any chemo, radiation, or surgery. if I get cancer. And then all of a sudden they're in that position. And now they start, the fear takes over, and there's so much mind games, and you have family pressure that that takes place. And so they, some of them end up then moving in that direction anyway, still with, support from what I do. So I would say that I mean, me personally, I don't see any reason, I don't see any time that I would do it.
Okay.
Um, I have a sister that is, battling lymphoma, and I know that she really doesn't want to do any of the things that I do. She leans on the traditional oncology. She's in Sweden, and that's fine. I mean, that's it. That's her choice. That's what she's comfortable with. She knows what I do, and anytime that she needs anything, I'm happy to be there. But it's and I know that other family members. So each family member is gonna choose a different path, and each one I'm there to support them in whichever way that they need.
So I told you offline that I interviewed Dr. Thomas Seyfried, and he does metabolic therapy with that DOM. I think it's the glutamine blocking drug, and he's seen benefits with that. So there's all these studies that are starting to come out. He mentioned to me that when they say there was a in the cancer treatment, there was something that happened and the person passed away. Oftentimes, it's that they couldn't handle the cancer treatment and they died from the medicines. So if there is all this information, why is it that even my first thought is, oh, I guess if someone in my family has cancer, we have to try chemo, obviously, but in tandem with ketogenic diets. But why is it that we all think that's the only option? And if we don't do that, then we're risking dying of cancer.
There's so much fear around cancer, and it's amazing because nobody wants to have cancer.
Right.
And because we have the fear, and we want to just kind of stay away from it, and we don't educate ourselves preemptively.
Mhm.
So frequently we then step in, the first time we start thinking about it really is if, you yourself diagnosed or somebody very close is diagnosed. And so it then kind of comes very sudden, and then we have the oncologists that say, if you don't do this, you will die. They say if you and it's fascinating actually. A friend of mine is actually the owner of the RNC, which produces the apricot seeds and the vitamin B17, and he on my podcast that I did he told the story about um, that he had a cancer scare. He came in and they told him, you have colon cancer, we need to operate and get rid of this immediately, and then we need to do chemo, radiation. So we have an opening in a couple of days. We can get you in, and we can kind of get operate and get rid of your colon, and so we can save your life. And come to find out, and so he initially then you say, oh, I have to do this, otherwise I'll die. And if they do this, then I can live 10 more years. If I don't do this, I'll die right now. And so you have that mindset or of the oncologist, and it's not that they always do that to kind of to scare you. I think they are doing it in a way sometimes. Well, I'm not going to say, but I think a lot of them are doing it from a good meaning point of view, that they feel that what they're doing is going to help, and but they come then only from a limited amount of information that they have, because they only function within their standard of care, so to say. So they only know their own tools. They don't know what vitamin C does, and they don't know what curcumin does, or they don't know what all these things do. So they come from their point of view, and then they use, the scare tactic in a way because they feel that they're saving your life with what they're saying. So my friend, lo and behold, come to find out that it wasn't cancer. And
Wow.
so it was just a blockage that was there because he had taken too much psyllium husk and bentonite clay. And so he was completely blocked up. and it looked like it presented as if it was colon cancer. And so so he said no to the surgery, and he was finally able then to go to the bathroom and cured his cancer because
Okay.
he pooped it out. Yeah, the psyllium and the
The clay.
bentonite clay. So it is important, and I hear this again and again in the podcasts that I do, and also from patients that I see, is that everyone say, "I wish I knew I had more time." And I think that is really important to understand, is that it is really, the oncologist, surgeon, all of them will push you to get going on therapy immediately. But recognize that the cancer is developed over years' time. So a little bit longer is not going to make that big of a difference. So it is then good to really pause and then evaluate the options that are available, because there are a lot of other options outside of just traditional oncology care, and then kind of feel what feels right for you as an individual. How do I want to incorporate all these different things? And recognizing that, yes, chemo will shrink the tumor, but it will have a long-term effect. You can't undo really the effect of the chemo. It is going to leave its mark in your body essentially for the rest of your life. And the same with radiation, the same with surgery. You can't undo a colon that you removed. It doesn't grow back. So once you've cut it out, it's gone. And once you've infused those chemo agents in your system, it's going to impact your immune system essentially for the rest of your life. So you're going to have a weaker tissue integrity, and where cancer later on, should it then come back, is then going to have an easier time than to express itself. So yeah, so it is a lot of it is scary. Cancer is scary, and it is overwhelming, and most people don't feel like they feel like they've lost control, when they are diagnosed with cancer. So when the oncologist says this is what we can do and this will fix you,
Right.
then you feel, oh, somebody that knows, and they study this and they worked with this, for all these years. They are the experts. Who am I to be able to question them? So then you just say, "Oh, he says he can fix this. This problem that's way too big for me."
Yeah, it's hard because fear sells, and fear, if you put fear plus urgency, that makes your decision making go away, because then, like you said, you're like, okay, I just got diagnosed with the scariest thing I never wanted, and this expert is telling me I only have this option, and that's the only way I could save my life, and so I must do it. And then so we have people we work with, and they are doing all of those traditional modalities, and they say, but I want to be on a ketogenic diet and eat carnivore and try to support the body as best. And the problem is that while they're going through it, they have no appetite, and they're having such a hard time because the medicines are so, or these drugs are so strong that they could barely consume anything. And so we have tried, and it is so hard, but we are not the oncologist, and they're always like, we want you to partner with our oncologist to, and it's just, I see how difficult it is, but that's not where we're dipping our toes. But I love that you're sharing all this information. So how important is the diet? You talked about mitochondrial function. Obviously a cleaner diet will help that, but how important is a ketogenic diet, producing ketones? I know you touch upon fasting as well. How important are these tools?
Anything we can do to starve the cancer, essentially. Because we know that, like we mentioned, it moves into that fermentation process where it starts with sugar, and then it moves into glutamines, glutamates, and then it can even move into fatty substances. Anything we can do to put pressure on its ability to produce energy, we are going to be so far ahead.
Okay.
We know that the process of producing energy that cancer uses is very inefficient, which means that it needs a lot of substrates. It needs a lot of, material to burn in order to be able to produce the energy that it needs. So one, it is inefficient, and two, it is fast growing. So, which means that it needs even more than a normal cell would, and it is inefficient in addition to that, which means that it's going to need a lot of blood supply to its location. And anything that we can interfere with that angiogenesis or the creation of all these highways of transporting food substances to the cancer is going to be very beneficial. And then anything we can do to interfere or slow down its ability to produce energy is going to then interfere with its ability to grow. And then hopefully, if it's starving enough, that it will just die because it's not getting enough nutrients. Shifting then your diet to make sure that you don't favor this fermentation process, a glycolysis process, then you're doing so much better. And ketogenic is one of those tools. And then you can obviously also bring in some natural substances like EGCG and curcumin and resveratrol and quercetin, and that can help and to interfere in these processes as well. And yeah, so that it becomes key. And if you are then choosing to do chemo, then what you really want to do is that you want to keep the cancer as weak as possible when you do that therapy. And so ketogenic fasting mimicking diet, becomes really, really important while you're doing it. There is that fear then that the oncologist will kind of put upon you. You got to eat, eat, eat. And they say it doesn't matter what you eat, just eat something because you got to keep on that weight. The challenge with that is that as you are eating your ice cream or eating whatever sweets there is, you're essentially feeding the cancer while you're trying to kill it. So it's going to be much more resistant to the chemo, and the chemo is going to be much less, it's going to have much less impact on the cancer. So if you do like the fasting mimicking diet around receiving the chemo, then what happens is that the chemo, because it is hungry and inefficient in producing energy, is going to open itself up for everything. And that includes the chemo. So you're going to have higher delivery of chemo into the cancer cell. And the beauty is that with healthy cells, what they do is that they actually hunker down. They go into protective mode. So the chemo will be less able to get into the healthy cells. And that is because the healthy cells, because they are more efficient in producing energy, they can stay in that defense mode for a longer period of time than a cancer cell can. A cancer cell is very, very vulnerable because it needs so much food all the time. And so to really benefit from that, while receiving chemo becomes really important.
So, just to reiterate, during chemotherapy, it is better to be on a ketogenic or fast mimicking diet so that the cancer cells are as hungry as possible, scavenging for energy, and then they would be more susceptible to the chemo too.
Absolutely.
Okay,
Absolutely. Yeah.
fascinating.
So, yeah, the worst thing you can do is to, do a bunch of sweets and things to really, yeah, yes, you'll make the dietitian happy, at the oncology center, but those dietitians, the only training they have is just to make you eat and
Right.
keep weight on, and that's it. And weight is not always the key. And so it is okay to lose. There's a difference between becoming cachexia and having healthy weight loss while going through chemo.
Okay.
So cachexia is a very inflammatory condition, and that happens when the body, when the tissue integrity is very weak and your nutritional content is very low. As opposed to losing weight, due to ketogenic diet or fasting mimicking, your tissue integrity is still strong and your immune system is healthy. Inflammation is low, which puts you in a much more advantageous spot. Even though you may be, a slimmer weight, you will still fare much better. So you have to almost get rid of that fear that they put into your head that, you got to gain weight, got to gain weight. The most important is that you gain weight. That is not the key. Having said that, though, if an individual just get to that point where they can't handle any food, and they are, because the chemo makes you can make you puke, can make you, nauseous, not wanting to eat anything, not able to eat anything. If you're in that state, then I tell my patients, first and foremost, you got to eat to live. So at that point, it doesn't matter what you eat as long as you eat something. But if you are in a good, strong state, and then ketogenic, fasting mimicking diet, are very good tools to use while going through chemo.
If we understand that these cancer cells are really aggressive, they have to grow fast, they need a lot of energy, they go through glycolysis, why not just get people to eat a lower carb diet in general as a preventative measure?
So, and that is really good to do. Ketogenic, I like ketogenic, but I don't feel that it's a lifestyle.
Okay.
The key is that we want to have that metabolic flexibility. Yeah, we need to be able to kind of shift, different energy sources. Ketogenic is good to kind of reprogram the body, to clear, to be able to shift to use ketones, and that's good for your brain. It's good for, what they see is that ketones are actually like signaling molecules, so they have more effect than just burning for energy.
Right.
And so they have an effect on the immune system, they have an effect on inflammatory control. So they impact the body in so many different ways. So it is good to get into that state from time to time. And you're absolutely right. It's good to do that as a preventative measure. And obviously, if you're diagnosed, then that's a good place to go immediately as well.
In terms of, so Mel Gibson has shared on Joe Rogan about three drugs that basically supported certain people to not have cancer anymore. One of them is fenbendazole. I was curious your thoughts on these drugs, why it works. Is it really that cancer is all just parasites? And then I think coupling it with again a ketogenic diet seems to have some benefits. But what are your thoughts about these things?
Yeah, so obviously parasites play a role, but it's so does mold, so does spirochetes, so does viruses, chemicals, heavy metals. So they do play a role. But the beauty with these drugs, and we call them repurposed drugs, because they were used for one purpose and now we're using them for another purpose. So the initial purpose for fenbendazole or mebendazole or ivermectin was to as an anti-parasitical. And yes, that's what they do, but they have so many other functions as well. Like ivermectin has about 50 different functions, antiviral being one of them, and then blocking different pathways that are important to block in relationship to cancer is a big deal as well. So, and in addition to being antiparasitical, but the main reason we're using these are because they are blocking the pathways that the cancer will use for its own survival. Like I mentioned, within the genome, there are upregulations of different, components, like, and then downregulation of others. Like P53, for instance, is, it's a component within the gene that is called the protector of the genome. And that P53 is vital for triggering cell death when it is appropriate. And so obviously a cancer cell does not want to die. It wants to live forever. And one way of doing that is then, bypassing, the mitochondrial activity, because the mitochondria and the P53 gene hold that cell death switch. So by bypassing the mitochondria and doing fermentation, we are then the cancer cell is able to live forever. And so P53 is then downregulated by the cancer. And, for instance, the fenbendazole helps to upregulate it, so we can then support then that cell death switch to flip, kill off the cell. So that's just one of the things that the fenbendazole does, in addition to then interfering with that fermentation cycle or glycolysis. Ivermectin then has a bunch of other, processes and, pathways that it works on. Then we have metformin that plays a role, doxycycline, atorvastatin. So there are a lot of these different pharmaceuticals that are used for other purposes that have been, that are very helpful in regard to controlling a lot of these cancer drivers that the cancer use for its own proliferation.
What are your thoughts about using those maybe once a year as a preventative? Because I mean, the thought is that cancers all live in us. It's just in the proliferation that it becomes toxic. So
Mhm.
if all of those can downregulate the cancer pathways, is it dangerous to just prophylactically take it once a year or something like that?
It is, and yeah, so like the ivermectin is very safe, and a lot of people do maybe like every week they take 12 milligrams of ivermectin. So they do that, and that helps a lot with antiviral, parasitical, and then also then to downregulate a lot of the cancer drivers. And same with fenbendazole. Maybe we do it for you do it for like a week's time, and do that ever so often. So I don't see any danger in that. Obviously, there are with fenbendazole. Sometimes I see when the liver enzymes start to go up, then the fenbendazole can be a culprit. So you do want to monitor that a little bit. You don't want to just kind of haphazardly just take a bunch of fenbendazole or ivermectin. It is good to monitor with blood tests and make sure that things are doing okay. Ivermectin, it's been pretty safe, but if you go up too quickly, I've seen people having a little bit kind of dissociation and kind of impact on their mind. So it is good to gradually increase that, and you can increase that if you deal with pretty serious cancer. Some people go up to even like 2 milligrams per kilogram body weight. So let's say a person weighs 220 pounds, that would be the same as 100 kilogram. So for a person dealing with a severe type of cancer, they may be taking then 200 milligrams of ivermectin per day. And ivermectin is best then to take on an empty stomach, but you wouldn't just start with 200 milligrams a day. You would gradually increase to that, just to make sure that, your body's doing okay with it. And because otherwise, you may feel the effect. Some people may not, but I've seen a number of patients that do. So yeah, taking them intermittently like that, as a preventative measure, I think that's perfectly fine to do.
We've seen people benefit from using ivermectin for long COVID, and I just wonder how much long COVID is all the other toxins in your system just waking up. But that's an aside. Okay, so that makes a lot of sense. In terms of, you brought up the autonomic nervous system. How much does the mind body, your trauma, things that you hold in your past, how much does that affect you?
To me, that is actually, beyond all these other things, what we talked
Really?
about, heavy metals and chemicals. I believe trauma, belief systems, are more important than anything. And I think that traumas can then be stored in the body in different locations, depending on what type of emotion that is associated with it. It will then kind of move to different, and locate in different areas of the body, and creating then a weaker area in that body, allowing then heavy metals and chemicals and pathogens to accumulate in that tissue. So yes, to your point, we can then clear out these chemicals and heavy metals and kill off the infection. But if we haven't addressed the trauma, it's still going to be like a gravity point for chemicals that we're exposed to on a daily basis, and they're going to start to accumulate there again. So to me, anytime you deal with cancer, anything that is chronic in any way, I believe trauma and belief systems are crucial to address. I mean, I would say everyone should address it anyway, for preventative measures. Like what we talked about, ivermectin, we should do a little trauma release ever so often. And so I think that, and most people, they say, well, my life is fine. I feel good. I'm happy, a happy marriage. I don't feel stressed. And yet they have cancer. And so there's still something there, even though it may be a long time ago. It can even be prior generations. You have these studies that were done on descendants from people that lived in German concentration camps. And they were seeing, 3 generations later, that they were experiencing exactly the same type of emotions as if they were in a concentration camp, even though their job was fine, family was fine, everything was fine. They were, their body was as if they were in that concentration camp. So it may not be just in your lifetime, it can be in a prior lifetime, and you're just holding that trauma still from that.
Yeah, it's fascinating. I started with just the carnivore elimination diet, and then we started seeing a subset that wouldn't heal enough with just diet alone, and we would do all the gut health and all the the functional testing there, and so then we had one person that did a mycotoxin test, and then I went into that rabbit hole, and then in that time I was reading The Body Keeps the Score and that book, and then I started seeing people that were starting to treat mold illness, but then so quickly they started getting scared of everything around them. And so we in our practice made a mind body program for that reason. And now we have seen so many people go through it that chronic illness, it just seems to that almost everyone that we work with that has chronic illness has some level of trauma. And some of the stories are really hard to hear, but there's always some level. And most people say, well, I've tried the meditation, I've tried this, I've tried that, and it doesn't work, or that's not the thing I need. But everyone that has gone through our program, that has truly gone through it, we have seen incredible healing. Where we have seen, for example, somebody that had panic attacks every day, even through the diet, even through SIRS, even through mold illness journey, it was the mind body program that allowed them to stop having these breathing issues or these panic attacks. And so it is in that, then it further facilitated to me of wow, this whole nervous system regulation, which then impacts the rest of your body, the cortisol release, the hormones, every nervous signaling, all of that, it becomes such a part of who you are, even though most people think that's not me. And it's such a hard thing to get people to understand actually the way you grew up, the way that your parents raised you. Like that stuff actually impacts your health today. So I am shocked to hear that for cancer specifically, you're saying that's the biggest lever that you would pull. And I believe it.
Yeah, yeah, I absolutely, yeah, without a doubt. If a person that's diagnosed with cancer doesn't do anything else but address their belief system, their trauma, um, yeah, I feel that then you've done, yeah, you're the biggest favor. I mean, like for instance, talking about ketogenic, good friend Naisha Winters, she went through her cancer journey. And this was before all her knowledge in how to eat and what to do. This was when she was a teen. And but one of the things that really helped her was addressing the belief system, the traumas, and she feels that that is what really turned things around for her. And so if that is the only thing that you do, I feel that that is the most important thing that you do. And then on top of that, you layer, what to eat, how to detoxify to address the root causes and, look for the mold, for the chemicals and all of that. And then on top of that, then we can bring in more of the heroic therapies that we do offer here at the center, like photodynamic therapies, poly MVA, DCA, curcumin IV, CBD IVs, and EBU, and all of these different things. Trudeau's, and you name it, that we, or mistletoe, or yeah. So there's so much that we offer, but that's kind of on top of building the foundation of right thinking, and then get right eating, and then we have movement. So that's kind of the triad that you need to stand on, and then we can build all these other therapies on top of that.
Okay, so my last question to you was going to be if you had to pick and choose a couple modalities. So I'm hearing movement, and maybe if you could just expand on that just by a little bit, diet. So if you any diet that would allow the cancer cells to starve as best as possible, and then the mindset, which I completely agree with you. I think the if you view that the world is out to get you and that you'll never heal, you're never going to heal. Like I fully believe that. So I think there's so much of that, and that's why I really do not like social media sometimes because there's so much negativity in there. So, it's like you're not healing because this wellness product or this wellness thing hasn't happened for you. And so it's like if I just need to buy all these things and then I'll be healed. And then it just becomes such a struggle. But if you just focus on positivity and things that inspire you, things that will allow you to heal, be in nature. Imagine how much more healing we can have without having to buy every single product. So I'm right there with you. But what about exercise? So the third one, what type of movement are you talking about?
So essentially any kind of movement. I mean, we know the more muscle that you have, the more you're able to fight cancer. Studies have shown that people that are diagnosed with cancer and that exercise and use movement therapy, they live 30% longer than people that don't. Here you have a free drug, so to say, exercise or weight resistant training that is going to ensure you to live 30% longer. There's no chemo, there's no pharmaceutical drug out there that can perform that well. In fact, if there was one out there that would have a 30% increase in length of life, that would be a multi-billion dollar drug. So here you have that just for free. And so movement, exercise, and you kind of do whatever it is that you can. Let's say that you're so beaten down by therapy or your cancer, and all you can do is walk to the bathroom. Then maybe next time, try to walk to the bathroom twice. Walk back and forth twice, or one and a half, and have a chair in the middle that you sit and rest on. So it just kind of keep pushing movement and keep pushing resistant training, doing little bands or do push up against the wall or whatever it is that you can do, to try to build muscle and to move about is going to be the best preventative and also the best therapy when diagnosed.
Do you know what it is about the muscle specifically? Is it that it absorbs some of the glycogen? Is there a reason why the muscle allows for longevity specifically for cancer?
I usually say if you express life, then life is
Okay.
what you're going to move towards. And anytime you move and you use muscles, then you're programming your body to live.
Okay.
So I think that aspect is really important. And then in addition to that, if we have muscles, we are essentially we are the muscles are utilizing the energy and the substrates or the building material that the cancer wants. So if we are in that anabolic state where we are building muscle, then the cancer doesn't get first pick, of all the different substances, and so then we're starving it, and it's not. And also the stronger tissue integrity that we have, then it's harder for the cancer to set up shop in a very, very healthy tissue. So if we start to kind of break down, then the cancer is able to kind of move through, into that tissue much more easily. So I think there are a number of reasons why exercise is so important.
I loved having Dr. Seafried on, but some of, his, as I always tell you, the drug is not even available. It's more in research purposes right now. So I need something today when I'm working with people that have cancer today. So I love the therapies and the integrative. As soon as I heard your talk, I was like, I have to have you on. And I hope that people get your book. I'll share it. But there's a lot of information in here and supports that you can have in prevention. So, where can people find your book? And if people wanted to work with you, it sounds like you do more than just cancer treatment at your place, if you can plug that.
Yes, yes. So, the book "A Better Way to Treat Cancer." I mean, it's almost 500 pages, but it's a manual that I wanted my patients to have, and that's what I put together because there's so many aspects of cancer that's good to know and understand, and also I wanted to be practical and for people to have action steps, and so. That's why I put that book together. So it's a book that it's a labor of love, and I know that it will benefit you tremendously. Whether you have cancer or not have cancer, it's still what to do in order to prevent, as the best that you can, and also create a healthy lifestyle. And for people that wanting to work with me for cancer patients, I also actually offer a free 15-minute discovery call. So you can just, call us at our center. We're the karlfeldtcenter.com. 208-338-8902. You can just call and then schedule a free discovery call and see if we are a perfect fit if this is what you're looking for, and also see if you're a perfect fit for what we're doing. Outside of that, we do offer therapies for Lyme, for chronic illness, for optimization. So we do all of that as well. Hormonal optimization, peptide therapies, exosomes, stem cells. So we have a lot of things that we do here, and we do telemedicine. So you don't have to live here, where we practice in order to be able to benefit from what we do. So we'd love to be there for you.
Okay. And you have the podcast too, correct?
We do, yeah. So you can go to So the book you can just go to Amazon and but Barnes and Nobles, pretty much every place out there will have it available, and so you can find that there. And podcasts, I'm on iTunes, Spotify, all the different outlets. So you can just type in my last name and it should pop up.
Okay. And I'll put it in the show notes too. Thank you so much again for your time, and our community who understands that sometimes standard care doesn't always work great. There are other options. And I think the more we know, the more we can act without fear as our first motive. And then we can then challenge a lot of the narrative we have in our head, our fear, our whether it's from our childhood, a lot of these things we could start challenging and realizing that sometimes our block is ourselves. And I just appreciate all that you do. So thank you so much for your time again.
Thank you so much. It's been a pleasure. Thank you.
In this interview, I didn't touch a ton about all of the different modalities that Dr. Karlfeldt uses in his treatment center for cancer. He has tons of machines and tools to use to work on eradicating the tumor or resolving a lot of the cancer cells. I wanted us to have the foundation and understanding of different approaches to cancer, tools and levers we can use, and why maybe radiation chemotherapy shouldn't always be the first tool. I think knowledge is so much power, and then you could look into all of the different modalities. A lot of the tools he used, you can't even get it without being in his practice or going to a practice that offers those tools anyway. I hope you do look into the tools and modalities he uses. You can go on his site and look there. But ultimately, I hope that you are not fear based when hearing about a cancer diagnosis and just trusting blindly the doctor that's in front of you that may be telling you the best knowledge that they know in their little bubble, but there's always other answers. So if the percentage of living longer or benefiting from these cancer treatments in standard care aren't always the best, maybe there are other options we can use to really live longer. Like Dr. Michael Karlfeldt said, if we build muscle, so if we do resistant training and just build muscle daily, we have a 30% higher survival rate even when getting diagnosed with cancer. That sounds like a pretty big win. I hope that this conversation gives you tools to understand that we should never treat an illness and lead in fear. Because when we lead in fear, we blindly follow, and that's when lots of things get really messy. You are always in control and you are always in the seat to make the decision that makes sense for you. And oftentimes, that may be using faith, leveraging mind body, learning tools to see what is right in your heart. And I know that's not always clear, but fear should not be the number one driving motivator. Fear from your family, fear from your doctor. Learn and absorb and find the right tools that make sense for you. Because for many people, chemo and radiation may not be the best answer. Ultimately, that's a decision you have to make, but it should be a decision. All right, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.